As a physician with years of experience in the field of oncology, I have witnessed firsthand the devastating impact of colon cancer. The disease often goes unnoticed until it reaches an advanced stage, making early detection crucial. Understanding the warning signs and symptoms of colon cancer can save lives. In this comprehensive guide, I will outline 8 critical colon cancer symptoms you should never ignore, and I'll share personal anecdotes and patient experiences to highlight the importance of vigilance. Introduction: the silent threat of colon cancer. Colon cancer, also known as colorectal cancer, is a formidable adversary. It develops when malignant cells grow uncontrollably in the colon or rectum. Despite being one of the most common cancers, it often remains undetected until it has progressed significantly. Early detection is key to improving prognosis and treatment outcomes. As a healthcare professional, my goal is to equip you with the knowledge to recognize the symptoms of colon cancer and seek timely medical attention. Symptom 1. Blood in stool. One of the earliest and most telling signs of colon cancer is the presence of blood in the stool. This symptom can manifest in various ways, from bright red blood on the toilet paper to darker, tarry stools. I recall a patient, Mr. Johnson, who came to my clinic complaining of intermittent rectal bleeding. Initially, he attributed it to hemorrhoids and delayed seeking medical advice. Upon further investigation, we discovered that the bleeding was due to a malignant tumor in his colon. Early detection allowed us to treat Mr. Johnson's cancer effectively, highlighting the importance of not dismissing rectal bleeding as a minor issue. Blood in the stool can result from several conditions, including hemorrhoids, anal fissures, or gastrointestinal bleeding. However, persistent or unexplained bleeding should always be evaluated by a healthcare professional. Bright red blood typically indicates bleeding near the rectum or anus, while darker blood suggests bleeding higher up in the digestive tract. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Symptom 2. Abdominal pain or discomfort. Abdominal pain or discomfort is a non-specific symptom that can arise from various conditions. However, when it is persistent and unexplained, it warrants further investigation. Mrs. Patel, a 55-year-old woman, visited my office with complaints of crampy abdominal pain. She described it as intermittent and often accompanied by bloating. Initially, she thought it was related to her diet. However, a thorough examination and diagnostic tests revealed a tumor in her descending colon. Early intervention enabled us to provide targeted treatment and improve her quality of life. Abdominal pain associated with colon cancer is often described as crampy, intermittent, or persistent. It may be located in the lower abdomen and sometimes associated with bloating. While gastrointestinal issues such as irritable bowel syndrome, IBS, or diverticulitis can also cause abdominal discomfort, persistent pain combined with other symptoms should prompt immediate medical attention. Symptom 3. Unexplained weight loss. Significant weight loss without a clear cause is another warning sign of colon cancer. This symptom often indicates that the body is struggling with an underlying health issue. One of my patients, Mr. Thompson, experienced a rapid weight loss of about 15 pounds over 3 months. He was not on a diet and had not changed his exercise routine. Concerned about his unexplained weight loss, he sought medical advice. After conducting several tests, we diagnosed him with colon cancer. The tumor was impairing nutrient absorption, leading to his weight loss. Prompt treatment allowed him to regain his strength and health. Healthcare professionals consider weight loss of more than 5% of one's body weight over 6 to 12 months to be unexplained. In the context of colon cancer, a tumor can impair the absorption of nutrients, leading to nutritional deficiencies. Additionally, the body's immune response to cancer can increase metabolism, causing a person to burn more calories than usual. Symptom 4. Fatigue. Fatigue is a common symptom of many illnesses, but when it is persistent and unexplained, It can be a sign of colon cancer. Ms. Ramirez, a vibrant 45-year-old, came to me with complaints of extreme fatigue. She described feeling exhausted even after a full night's sleep and found it difficult to complete her daily tasks. Suspecting an underlying issue, I ordered a series of tests, including a colonoscopy. We discovered that she had a tumor in her colon causing anemia, which was the root of her fatigue. Treatment not only addressed her cancer, but also alleviated her debilitating tiredness. Fatigue related to colon cancer is more than just feeling tired. It is extreme exhaustion that interferes with daily activities. This fatigue may be due to anemia, which occurs when a tumor causes bleeding in the gastrointestinal tract, leading to iron deficiency and a decreased number of red blood cells. This reduces the blood's ability to carry oxygen, resulting in fatigue. Symptom 5. Anemia. Anemia is characterized by a reduced number of healthy red blood cells, leading to a lack of oxygen supply to the body's tissues. It can result from various causes, including chronic diseases and nutritional deficiencies. Mr. Williams, a 60-year-old retiree, came in with symptoms of fatigue, pale skin, and shortness of breath. Blood tests revealed he was anemic. Further investigation through a colonoscopy uncovered a bleeding tumor in his colon. This timely diagnosis allowed us to address the cancer and improve his overall health. Colon cancer can cause anemia through gastrointestinal bleeding. This bleeding is often unnoticed and can gradually lead to a significant loss of blood, decreasing the number of red blood cells and the blood's capacity to transport oxygen. Symptoms of anemia include fatigue, pale skin, shortness of breath, and cold hands and feet. While anemia can be a symptom of colon cancer, it is important to rule out other potential causes. Symptom 6. Rectal bleeding. Rectal bleeding is a significant symptom that should never be ignored. It can be a sign of various conditions, including hemorrhoids and gastrointestinal bleeding, but it can also indicate colon cancer. Mrs. Nguyen, a 52-year-old teacher, noticed bright red blood on her toilet paper. Initially, she attributed it to hemorrhoids and did not seek medical advice. When the bleeding persisted, she consulted me. A colonoscopy revealed a tumor in her rectum. Early detection and treatment were crucial in managing her condition and preventing further complications. Rectal bleeding refers to the presence of blood from the rectum or anus. The color of the blood can vary from bright red to dark red, depending on its source and the time spent in the digestive tract. Persistent, severe, or unexplained rectal bleeding should be evaluated by a healthcare professional to rule out serious conditions like colon cancer. Symptom 7. Constipation. Constipation is a common digestive issue, but when it becomes chronic and is accompanied by other symptoms, it can indicate a more serious problem, such as colon cancer. Mr. Lewis, a 50-year-old accountant, experienced chronic constipation for several months. He tried various over-the-counter remedies, but his symptoms persisted. Concerned, he visited my clinic. A thorough examination and colonoscopy revealed a tumor obstructing his colon. Early detection allowed us to remove the tumor and restore normal bowel function. Chronic constipation is defined as having fewer than 3 bowel movements per week and experiencing these symptoms for an extended period. Colon cancer can cause chronic constipation due to the presence of a tumor in the colon, obstructing the normal flow of stool. It is essential to distinguish between occasional constipation, which can result from dietary choices or stress, and chronic constipation, which may indicate a more serious underlying condition. Symptom 8. Diarrhea. Diarrhea, characterized by frequent, loose, and watery stools, can be a symptom of various underlying health conditions. When persistent and unexplained, it is essential to consider the possibility of colon cancer. Chronic diarrhea can lead to dehydration and nutritional deficiencies, significantly impacting overall health and quality of life. Ms. Stewart, a 48-year-old manager, experienced frequent episodes of diarrhea that lasted for several weeks. She initially thought it was due to stress and dietary changes. However, the persistent nature of her symptoms led her to seek medical advice. Upon conducting a colonoscopy, we discovered a tumor causing partial obstruction in her colon. This obstruction altered the normal passage of stool, leading to her diarrhea. Early intervention was crucial in managing her condition and preventing further complications. In the context of colon cancer, diarrhea can occur when a tumor partially or completely blocks the colon. This blockage prevents normal bowel movements and forces the body to expel waste more frequently and in a more liquid form. The body's response to this obstruction may involve increased motility of the intestines, which results in more frequent loose stools. Chronic diarrhea should not be ignored because it can lead to severe dehydration, where the body loses more fluids than it can replace. Dehydration affects the balance of essential electrolytes and can lead to serious health complications. Additionally, chronic diarrhea can cause significant nutritional deficiencies as the body loses the ability to properly absorb nutrients from food. It's important to differentiate between diarrhea caused by benign conditions, such as infections or dietary choices, and diarrhea that persists without a clear cause. Persistent diarrhea, especially when accompanied by other symptoms like abdominal pain, weight loss, or blood in the stool, should prompt immediate medical evaluation. As a physician, I emphasize the importance of not dismissing persistent diarrhea as a minor issue. Seeking medical advice early can lead to a timely diagnosis and treatment, improving the prognosis and quality of life for patients with colon cancer. If you experience chronic diarrhea, consult a healthcare professional to determine the underlying cause and receive appropriate care. Conclusion: the importance of vigilance and timely action. As a physician, I cannot stress enough the importance of being vigilant about the symptoms of colon cancer. Early detection and timely medical intervention can make a significant difference in the prognosis and treatment of this disease. If you experience any of the symptoms mentioned above, please consult a healthcare professional without delay. Your health and well-being are paramount, and recognizing the warning signs can save lives. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. In my years of practice, I have seen the profound impact that early detection and treatment can have on patients' lives. By staying informed and proactive, you can take control of your health and reduce the risk of advanced colon cancer. Remember, the key to triumphing over this disease is to never ignore the warning signs. If you found this information helpful, share it with your loved ones and encourage them to seek medical advice if they experience any concerning symptoms. Together, we can raise awareness and improve outcomes for those affected by colon cancer. Stay informed, stay healthy, and don't hesitate to seek help when needed. Thank you for taking the time to learn about the critical symptoms of colon cancer. Your proactive approach to health can make a significant difference in your life and the lives of others.